Now, Taoiseach Micheál Martin has given an upbeat assessment of where we are in the path out of lockdown, committing to get things reopened as fast as possible in May. He confirmed hairdressers, high street shops and construction should be reopened from next month. But is that too optimistic? We're joined by Anthony Staines, Professor of Health Systems at the School of Nursing and Human Sciences in DCU. Anthony, what's your take? Is it too optimistic?
I think it might be. I think we're going to find out. Numbers are clearly going up and down very slowly. Now, they've come down yesterday.
Oh, they've been going down for about 3 weeks, Anthony, haven't they?
They're staying around 300-400 for most of the last 2 weeks. So they are coming down, but they're coming down very, very slowly. And we don't really know what's going to happen. I don't think it's a good idea to be certain this will happen. If it does happen, that's great. That's fantastic. And no one will be more delighted than I will. But it's going to be challenging, and we're not certain what will happen. But it's going to be very difficult to bring the numbers down to a level at which we can open up a lot of things without having another wave of cases. And NPHET have expressed their worries about this over the last few weeks, and I think they're not being unreasonable in that.
What would you like to see happen? Because it looks to me like zero COVID has completely gone off the political agenda. The opposition parties, which were kind of screaming it from the rooftops, they're pretty quiet about it at the moment.
I think what we'd like to see is what the Taoiseach has repeatedly called for, which is strong suppression. And if you get strong suppression, which is very low numbers of cases, then you can have the conversation about do you try and go down to zero or not.
Have we not been trying for that since the 1st of January? Have we not been trying for that since the 1st of January, Anthony?
We've been trying. We haven't been doing the things that we needed to do to make it happen.
Such as?
The big thing we've missed is we are now a year into a pandemic with the same regional public health workforce that we had a year ago. Countries that have successfully controlled this have very substantially increased activity in regional and local public health. So they've had very aggressive case-finding approaches, very aggressive contact tracing approaches, and they've supported people in isolation. We're not doing any of these things.
When you say we're not doing,
they are not deep.
When you say we're not doing anything, I mean there is pretty extensive contact tracing.
We've been tracing contacts back a week for the last 3 weeks. Before that, we were tracing them back 2 days, which was an utter waste of time. This is a virus where people often test positive 7 to 10 days after they get infected. So we're missing a lot of the transitions. We're missing a lot of the contacts. We're missing a lot of the spread. We don't have the information systems to track that, Joe infected Mary, who infected Bridget, who infected Michael, Jack and Jill. Other countries do. We don't know any of that stuff. We don't know where most cases.
When you say other countries, I'm just curious, which countries? Because I don't see any other countries really, apart from New Zealand and Australia, which have basically just shut down their countries to outsiders. I don't see any other country that's really shooting the lights out, particularly when it comes to
South Korea. Shooting the lights out.
Yeah,
Atlantic.
I know,
Canada
but countries that we can identify with, that are in the same position, that, for example, that are members of the EU.
The countries who invest in the EU has been doing best for a long time is Finland. Other EU countries have brought in a variety of border restrictions over the last few months. Much to the displeasure of the Commission, by the way. The Commission does not like any of this.
Yeah.
But they have brought them in, and they've stuck to them. We find ourselves looking at a virus which is costing our economies an awful lot of money, and which is still making a lot of people sick, and has substantial long-term side effects in maybe 1 in 10 of the people who get it. I think there's a strong case to be made for controlling it, and that is the government's policy. That is what the Taoiseach has called for, not just me.
Okay. All right.
So strong suppression is the name of the game, I think.
All right.
We have to do it.
We will leave it there. Anthony Staines, Professor of Health Systems at the School of Nursing and Human Sciences in DCU. Thank you for talking to Newstalk Breakfast.